Hi there, I'm Sally, and I want to talk to you today about something that's kind of freaky to think about, but it's important. It is important. We have to talk about this, and we've got to start having this on our radar. Okay, it's very, very important. You have been lied to about parasites, point blank. We have been told that we live in a first world country and that because of our hygiene practices, we don't have to worry about parasites in America, that it's really rare and it's mostly if you go somewhere else. Okay, well, we have dirt, and the food grows in the dirt. Parasites live in the dirt. And yes, thank God, our water is treated to the point to where you don't get dysentery by drinking water here in the US. But there's still, that's not the only pathogen out there. There's still all kinds of parasites that you can get that aren't just from dirty drinking water. I mean, of course, yeah, you get parasites from dirty drinking water, but you also get them from eating even healthy food. Okay, now I'm going to tell you, there's Dr. Donald Fuller. He is a veterinarian. Look him up. He wrote a book. And I may even do a piece just on him. But this wonderful, wonderful man, he's a veterinarian, and he is an expert at finding parasites in stool. Okay, so I will tell you, my son was sick. He was having autoimmune symptoms. He was having neurological symptoms. It was looking really, really scary. All of a sudden, part of his body would just go numb, and he would just feel like he was going to pass out, running fevers for no reason, terrible, headaches and insomnia and all this kind of stuff. I took him to 7 doctors, okay? 2 neurologists, a rheumatologist, regular doctor, 3 naturopaths. It was a veterinarian that found out what was wrong with my son. So the last naturopath that I took my son to, he said, I'm going to test him for parasites. I'm like, okay, that's great. We've already done that. We can do it again, but like, which lab are you going to use? We'd already used Vibrant, $500, something like that. Came back, no parasites. They found all kinds of other stuff, but they didn't find any parasites. But whatever, I'm up for it. Let's do it. So I said, well, who do you use? And he said, I don't use any of those labs. He said, you know why? Because they never find anything. And I'm like, I know. He said, I use a veterinarian. So we sent the stool to the veterinarian. He found 2 parasites. 2. When I looked up the signs and symptoms of the one parasite, they call it a dog tapeworm, Diploidium, he had almost every symptom. This parasite robs you of your B12, so that's why you have neurological symptoms. I mean, I thought my poor kid I thought he had MS, I mean, it was horrifying just watching him waste away in front of me and us not having any idea what's wrong with him. His ANA was always elevated, okay? So that's like a lab that you look for autoimmune illnesses. We did that like 3 times. It was elevated. This was really, really scary. And just to look at the symptoms, I'm like, it's textbook. How many people are suffering from this, having these terrible illnesses, about to get diagnosed with some kind of autoimmune disease, and just think that that's their lot in life when it could really and truly be a parasitic infection? So once my son started taking the medication for that particular parasite, it's called praziquantel. Once he started taking that medication, he got better. He got better. He got well. He got well. So I asked Dr. Fuller, I said, why can you find these and nobody else can? I mean, for myself even, I've used Genova, Vibrant. I can't even think of the names of all of them. Probably anyone you can mention I've used. He said he doesn't use the preservative, and that is true. If you've ever gotten a stool test, sent to your house or whatever, you get this little vial and it has this pink solution in it, right? And Dr. Fuller calls that a brine. I think it's like a preservative. He said that causes the eggs to burst and it peels the skin off the parasite. So even if they find something, they can't identify it, right? And for many years, for about 10 years, twice a year, I would get tested because I had SIBO, I had all these problems and I was sick and I couldn't get well. And I could always trace it back to an episode of food poisoning. Anyway, all my lab tests for parasites were negative, 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 negative. It was ridiculous, okay? I'll do a different video on how I did use one lab called Parasitology Lab in Scottsdale. They found one parasite in my stool and one in my urine. So at least they do test your urine. But they still missed the diploidium because I had Dr. Fuller test me as well. And I had it. And since taking the praziquantel, my heart doesn't hurt anymore. Okay. I blamed that on COVID. But I think what happened was COVID weakened my immune system and I already had this parasite. And so it got a leg up. I don't have the body aches, the muscle aches that I had. I look at my I have this cabinet of like a million different supplements because I've had so many things happen to me and I've tried this and I've tried that. Most of the things I tried because of SIBO. But I was looking at that today and I'm like, I don't take any of this, hardly anything anymore because I got a handle on the parasites. I gotta be honest, I don't know if you can ever really eradicate parasites because different people have different theories about whether or not you can kill the eggs, and then there's biofilms. So even if you can kill them, if they're hidden under a biofilm and they're protected, these parasites lay like 2,000 eggs a day. So I don't know if you ever like really eradicate them. Then plus you got to figure, could you not contract it again, right? So for me and my son, we're on like a maintenance dose. So it's not something that we take daily, but we certainly take it every couple of weeks or every month. We took it much more frequently than that in the beginning. And if you're interested in things like that, leave it in the comments and I can answer some of that. But, you know, especially my son, since it was pretty much killing him and I was watching him waste away in front of me, you know, he will be on a maintenance dose probably for life. But I really try to bring awareness to this because how many people are suffering and nobody can figure out what's wrong with you, and you've already wasted money on parasite tests, and you've been told that you don't have any. I mean, and that's so sad because then you go the wrong direction, right? You're like, oh, well, at least I can rule that out. Well, let's go see about if it's this or that, you know? When no, you were actually headed in the right direction and you were lied to. Okay, the lab didn't mean to lie. But as our American belief, we've been lied to. We've been taught that we really don't have parasites here. It's not a big deal for us when it is. And our tests are inept. They are ridiculous. If you've got parasites in your lungs, and you can get parasites in your lungs, and there's one particular one called strongyloids, and that can cause ARDS, which is deadly. Okay, the treatment for that is ivermectin. But there's other parasites that can be in your lungs, okay? If they're in your lungs, you're not going to find them in your stool when you're doing a stool test. These other, and that's the other thing too, it's important to know which parasite you have because they don't all respond to the same medications. So if you want to get, you know, the proper treatment, like the first two parasites they found in me, when I had the nematode in my urine, and then I had, cryptosporidium, that's what I had in the stool. So once I took those medications, my SIBO symptoms went away, but I still had the diplydium. See? Affecting my heart, causing joint pain, causing muscle pain, the worst muscle pain I can't even explain. I'm going to do a video on that too. I am, because I don't want to get off on a tangent. That's like I could do a whole thing on that. But the muscle pain, and it's interesting because I was thinking that maybe I had the infection that you get from pork tapeworm, trichinosis. And so I did, you can do a blood test for that, and that came back negative, but I didn't have that. I had the diplydium. You know, in other countries, they have test kits that literally you prick your finger and they can test your blood, and through your blood tell what kind of parasites you have. I think that's more effective than just hoping and praying that you actually find one in your stool. You have 20 feet of intestine. What makes anybody think you're going to find a microscopic parasite? I mean, it's a miracle that they ever do. Sometimes they do, but it's a miracle. These things are causing horrific symptoms and horrific illnesses. And I'm really trying to bring awareness to this because it's very, very important. So in other countries, they test differently. I don't know. There is a lab called Diagnose Lab, and they do a sputum test and a stool test, which I find that fascinating. I haven't done it. I may actually do it, and if I do it, I'll make a video and let you know what I think about it. But if anybody out there has done that test, I'd love to know if they found more in your sputum. I think that is a great way to go. I think you probably would be more likely to find them in your sputum than in, especially like they're microscopic and whatnot. Of course, some, if you have them long enough, some of them can grow to, an adult size and not be microscopic. But I'd love to know if anybody out there has done that test. Please leave me some feedback and let me know, because I think that's a great avenue to look at. Diagnose Lab. That's one of those labs, though, that you have to get your doctor to get set up with them. You can do Parasitology Lab in Scottsdale and get your urine tested. If you're going to do the stool through them, I wouldn't stop there if they don't find anything. Okay, I wouldn't. Or if they do find something and you take a treatment and you still have symptoms, I would try other labs too, because they could be missing something. And let me tell you something else that they told me about that nematode that was in my urine. Okay, so they called it a nematode because that was the classification that this particular parasite would have been in. They couldn't tell me which parasite it was because it was so small. And they said, which I do not agree with, this is what they said, okay? It could be that parasite is just passing through, that it's so small and I'm not the proper type of host that it was never going to do anything inside of me other than pass through. Okay, well, since I have treated it, I no longer have cystitis. Okay, I don't pee when I cough. I don't pee when I laugh. It is what it is, It is what it is. But I'm going to tell you right now, and I'm going to do another video on cystitis. If you have cystitis, you can get a product called, I think it's called UTI Cleanse or Urinary Cleanse, but it's by a company called Life Seasons. And I took that for a long time before I knew that I had a parasite in my bladder, and it did really, really help, with the symptoms of cystitis. But since I've taken the anti-parasitic medication, I don't have to take that supplement anymore either. So I want to get this information out there, and I would love to read some comments, and please ask me questions and let me know if you want me to make, some videos on some of these topics that I've mentioned a little bit more in depth and whatnot. Good luck on your health journey. Take care.